But we're going to start today with a problem that is surprisingly common, and that has to do with vestibular disorders. I was surprised to learn that 70 million Americans suffer with dizziness and vertigo on an ongoing basis. 80% of people age 65 or over have this sort of unexplained dizziness problem, this feeling lightheaded or floating, rocking sensation that just doesn't seem to go away. Vertigo refers to when you have a spinning or whirling sensation, either because you're spinning or the world around you won't stop spinning. In some cases, it's so severe, people just can't function. It can lead to nausea, and even if you're not that sick, it can still just wear you out, and the fatigue takes it out of you and sort of makes life miserable. So what can you do about this problem? Well, many people wind up in the care of audiologists at the Hearing Center, operated by ENT Associates. So I talked with audiologists Kate Hull and Elizabeth Davis and asked Elizabeth to explain, why would an audiologist be trained to help me with balance problems?
So if we look at the anatomy of our ear, it actually can be divided into two parts. One part is our hearing organ, the cochlea, which a lot of people are familiar with. The other part is our vestibular organ, which is a center of our balance. There's a lot of things that go into balance, but because these two organs are so closely linked, a lot of times hearing problems can also affect balance problems. So audiologists are trained and educated to evaluate both.
Got it. And interesting that a hearing problem affects balance as often as it does. Tell me more about that. What type of a hearing problem, what type of a balance problem does that result in?
So hearing problems can guide our providers in diagnosing different balance problems. So whenever we do an evaluation for someone who's having symptoms of dizziness or imbalance, they're always going to get a hearing test first so that we can better guide the provider as to what steps are needed next in evaluating and getting a diagnosis. Patients who have imbalance and dizziness are sometimes the hardest to diagnose because there's so many parts of the body that can cause those symptoms. And it's a process of ruling things out to get a solution and then a treatment plan for them.
Oh, I want to drill down on that a little bit. Let's talk about the difference between dizziness and balance problems. So I think people kind of lump that all together, but they are different?
Mm-hmm. They are. Balance is different from dizziness. And the word dizzy is a big umbrella term. It can mean a lot of different things for different people. One thing that we always do is really dig into what does it mean to you, your specific symptoms. Are you lightheaded? Are you spinning? Are you woozy? Are you floating sensation? It's a little bit different for everyone. And sometimes you don't have great words or ways to describe it, but just doing your best to really describe what you're going through can really help us on our end. Dizziness is most often with sensations of spinning, either you're spinning or the room's spinning, or just general sensations of unsteadiness. You are woozy, you're lightheaded, things like that. Balance disorders can be different factors as well. So if you are unsteady or if you often trip, that can be different than dizziness, because if you're tripping over rugs, you're not necessarily dizzy. We might have some other things going on.
So were there other parts of the body you said that can affect those balance and dizziness issues, not just what's happening in our ears? Tell me about that.
Absolutely. We have three kind of systems of balance. One is your vestibular, which is your ears, which is your inner ear that Elizabeth was talking about earlier. You also have proprioception, which is your feet on the floor, your physical body, kind of understanding where you are in space. There's also your vision as well. So your eyes will be relaying information, and all of those things combined can give us good balance. The best example that I have is when you're in a car and let's say someone next to you starts moving, but you're staying still and your body goes, ooh, because you have that sensation of movement even though you're still, because your eyes saw the other car moving. You can come back from it pretty quick, but that is just an easy example of the difference when we have a difference between any of our systems that can cause that imbalance.
So conditions like peripheral neuropathy, that kind of thing that interrupts your sense of feeling in your feet, that's what you're talking about as leading your brain and giving it misleading signals?
It can. It can.
So when you're diagnosing, how do I need to describe what's happening to you to help you figure out what's wrong with me?
So it's really important when a patient comes to us to describe the timeline of events. When did it come on? What is sudden, gradual? Has it continued constantly since then? Or is it coming in episodes? And then what other symptoms are coming along with the dizziness? Are they nauseous? Are they also lightheaded? Are they spinning? Really trying to label the sensations that they're feeling can help guide us to see what actually could be causing those feelings.
And I've also read that medications, many other things, and not just an inner ear disorder, can be associated with these problems.
Yeah, so medications can definitely have the side effect of dizziness, and it also can have the side effect of suppressing responses to our tests. So whenever we do testing, we actually stop any medications beforehand so that they're not affecting your system, and our tests actually are diagnosing and testing how your system is working normally without the effect of medications. So certain medications being used too much, such as allergy medications or depression medications, those are known to suppress your central system. And it could be suppressing things that are actually good for you. So I would recommend talking to your doctor about what medications that you're on and seeing if you need to make a change to see if that's causing the symptoms, but definitely not something that we would change during an appointment.
So when you move into treatment after you sort of figured out what's going on. Well, let's stop a second and let's identify some of the conditions that are associated with this. There are lots of different sort of factors that go into play here. BPPV is probably the most common. So detail that for us and explain exactly what's happening there.
So BPPV can be divided down by that acronym. So the B stands for benign. It's not life-threatening, even though it's not a good symptom or sensation that the patient experiences. Paroxysmal is the second letter, and that means it came on really suddenly. And the positional means it was triggered by position, and then the final letter V is vertigo for the spinning. So basically the person suddenly has a lot of spinning whenever they move their head, and it goes away pretty quickly, but it's really common as we get older for this to happen, and it's caused by crystals in our ear coming loose and going to places they're not supposed to. And so they may not even know that anything has happened to trigger it. So that's why it seems so sudden. They don't know the crystals have come loose. And then they have these very severe symptoms. And a lot of times these patients will end up in the ER because they don't know what's happening to their bodies.
The first step is always diagnosis to see if that's what we are looking at. The symptoms are pretty common, as Elizabeth was saying. They are also one of the most treatable forms of dizziness. So first, to diagnose, we do this test where they lay back with your head hanging off the edge of the table. We're able to look at the eyes and see if the eyes are showing any motion. When we see motion in the eyes, because our eyes are actually connected to our ear. So with that diagnosis, we are then able to kind of look at the next step. The epley maneuver is the most common form of treatment for that. It can be done in a lot of different places. We see it a lot at physical therapy offices and at ENT offices as well.
So this epley maneuver, what does that involve? It's not an invasive procedure, I'm sure.
It is not an invasive procedure, not at all. It requires a sit-up, essentially, and that's the hardest part about it. But the doctor will be supporting your head the entire time. You'll be laying back with your head hanging off the edge of the table or a bed, anything like that where they're working on. You'll be laying there for a little bit, and then as we lay down, we're able to kind of adjust those crystals. So as Dr. Davis was saying just earlier, those crystals are out of place. So we're wanting to put them back in the correct place. So by hanging off the edge of the bed, we're going to be modifying where those crystals are and helping to pop them back into the right place.
Go ahead, Elizabeth.
I describe it kind of like the part of the ear where the crystal has fallen is like a hula hoop, and it's got a stone in it. So we're rolling their head around into different positions to get that stone out of the hula hoop and back to where it's supposed to be.
Oh, that helps a lot. Yeah, that's a good mental image. Yeah. So is this a one and done, and then the problem is not likely to come back, or is this something I'm going to suffer repeatedly?
We hope that one treatment will solve the problem, but there are people who suffer from chronic BPPV and need to do this repeatedly. After the first couple times, they get into the rhythm of it and can often treat themselves at home without having to come in.
Do we know what causes this yet? Is there any through line as to why this problem occurs?
So for younger people, oftentimes it's going to be caused by a head trauma. So if you were in a car accident or anything, hit the head, could knock those crystals loose. That's the only cause of it for people who aren't predisposed to it. But as we get older, the connection where the crystals rest becomes less sticky, for lack of a better word. And so they come unstuck more easily just as we get older. So nothing that anyone can do to prevent it, but definitely treatable.
I'll bet that's pretty terrifying if you are old and already sort of unsteady on your feet and have this come along. Does it disable people? What do they tell you about how it affects their lives?
Balance is something that a lot of people take for granted, and we don't realize how important it is until it's gone. When we're experiencing dizziness with spinning, it can be debilitating. It can be scary even, because you don't quite understand what's going on and you feel out of control. But just know that it's not hurting or harming you in any way. It's just there, and it's frustrating, but that's what we're here for, is to help get that diagnosis and to help put you on a path of getting to feel better.
Migraines are also an ongoing issue. We just talked about this recently on the program, but didn't get to the issue of balance disorder associated with migraines. Tell me more about that.
So a lot of people who have migraines also are going to have vertigo or balance problems. And this is something that's been more recently linked in the literature in the past 20 to 30 years. It's becoming a lot more commonly researched and diagnosed. And they're finding a lot better treatments pharmacology-wise to help those balance systems while also treating the migraines.
What's the connection? Do we know what the causative factor is between a migraine and a balance disorder?
It depends a lot on what's causing the migraines, because there's a lot of different types of migraines. So I would refer more to a neurologist who's evaluating what's causing their migraines to find out how it might be affecting their balance system, whether it's a lack of blood flow or tension in the muscles, that type of thing.
So help me understand, it sounds like that's the best way for me to touch and use your professional training is diagnosis and helping me figure out what's really going on. So walk me through that. When should I start make the appointment to see you? What are the conditions that are occurring in my life that usually bring people to you?
It's different for everyone. As I said earlier, balance can be debilitating, and something that is minor to someone else could be a major issue for someone else. So it's unfortunately pretty person dependent, but at the point where you're having spinning, if you are genuinely dizzy, if things are unwell, or if you're unsteady, anything like that, we could start having that conversation of what to do to get you feeling better. Maybe it's seeing us and going through diagnostic testing. Maybe it's going to go see a physical therapist. Maybe it's seeing a neurologist. There's a lot of different paths that we can go down.
I think your primary care physician is definitely the first stop to talk about what issues you're dealing with, because they know your full medical history and might be able to pinpoint right away what the cause is. But if it's something outside of what they would expect based on your history, that's when they refer to specialists like the ENTs, who get us to do the balance testings with you.
So I'm glad we had this conversation. I think a lot of people just kind of suffer in silence and put up with this for a long time. It's good to know that there is help available. I just want to wrap up here with a quick conversation on one of the conditions that is most associated with balance disorders that you say is not really all that common, and that is Meniere's disease. Tell me more about that.
So Meniere's disease is a diagnosis that became a lot more popular or common, and it's a combination of a lot of symptoms, including hearing loss, roaring tinnitus, and what are considered drop attacks of vertigo. And while it is a common diagnosis, it's sometimes overdiagnosed, and if people aren't getting the appropriate treatment, then they could be trying to treat something different and not being successful in alleviating their symptoms. So we always recommend, rather than referring to what might be the most popular thing that pops up on a Google search, to see your provider and get testing to find out if that's actually what's affecting your life.
Yes, Dr. Google doesn't always have the right answer. I have to agree with Elizabeth on that. So that is Elizabeth Davis and Kate Hull from the Hearing Center. And as you can tell, they're very well trained and understand these vestibular problems quite well. So if you'd like to reach out to them and see if they can help you get your feet back on the ground in a firm setting, you can reach them at the Hearing Center. You'll find the phone number at enthearingcenter.com. That's enthearingcenter.com.